Hello, I'm live. Happy February. Happy February 9th, but we're going to be celebrating like it's February 14th because I don't know if you could see it if you're on the horizontal view, I have a little heart. And if you're on the vertical view, there's the heart. Anyway, how's everyone doing? How y'all doing? How y'all doing? Let me get organized and then we'll talk teeth. I'm so excited to simply, do a toothy Q&A. I think I've done 25 or 26. Maybe last live was my 25th. So I think this is my 26th live, which is pretty cool. Hi, Ari. Hi, Stacy. Hi, Rory. Hi, Eddie. How y'all doing? How y'all doing? Where are we all at? Dream Chase, LOL, Mr. Monkey, Rashida, K Millens. Hello. Thank you all for being here. James, where's everyone located? Where are we at? I'm in Chicagoland and it's cold, freezing. Oh, we have a question already. Okay, I'm so excited. So yes, we're going to do questions. Yeah, we're going to do questions. And don't forget to use the super chat and the stickers. The more you engage, for example, like the more you're typing, the higher you could rank on the leaderboards here on YouTube. Like the top 3 engaged viewers get special badges next to their name, all this fun stuff. So just some housekeeping. There's loyalty badges. There's colorful tooth emojis. If you're a Teeth Talk member on YouTube, it's kind of like Patreon, but it's a YouTube membership. So that's an option too. If you see anyone with the tooth emojis, let me see here. And then you can also give random gifts of the membership as well. And yes, thank you, K Millions. Don't forget to like the live as well. The more likes this live gets, the more dental health awareness we could spread through the YouTube world. So will this live be recorded? Yes, it will. So you'll be able to watch it later as well. So yay, someone's in Kentucky, Midwest. What's up? What's up? Okay, Texas, Cleveland, Ohio, San Antonio, California. Ooh, you're nice and warm over there, most likely, unless depending what area. Australia. Someone's from Australia. That's amazing. In the UK, hello. Makes me so happy. Okay, Atlanta, Washington, D.C. I'll be in D.C. in July. Well, D.C., Maryland area. California. Oh my goodness. Okay, I'm so excited. Thank you all so much for being here. Let's talk some teeth. Okay, I saw a question. I'm trying to scroll back. It was something about purple gums. What did you ask? Let me see here. Someone asked about purple gums, and now I don't know where it went. Brazil? Sorry, I'm like getting distracted. Minnesota. New Zealand. Lord of the Rings, Lord of the Rings. Oh, someone asked, what does purple and red gums mean? Okay, great question about the gums. The gums, as a dental hygienist, that's my whole thing, right? We're all about the gums, right? I remember when I got into dental hygiene school, I was like, oh my goodness, teeth, teeth, teeth. I'm all about teeth. I love teeth. And when I got into dental hygiene school, I was like, wait, it's all about the gums. I got to start loving the gums. You start realizing how important the gums are when you learn more about teeth, because the gums are what's holding your teeth in place. Anyway, to answer your question, purple and red gums. Okay. So depending, it's a spectrum of color generally, but in general, healthy gums lean toward a pink color, right? Pinker, firmer, stippled. We call it stippled when the gums are firm, right? If you blow air at the gums, they're not going to flap. That's healthy gums. Now, you asked what purple and red means. Now, purple, if they're still pretty pink, but you see like areas of purple, it could be amalgam tattoos. It could be just areas of your gum tissue that naturally look that color, right? Different color. There can be different color gums depending on the color of your skin, right? Like your gums can change color just like your skin kind of changes color over time if you're in the sun too much, things like that, or just genetically. All this to say, purple is like a gray area. Funny using a color to describe a color, but purple gums, if it's localized, is different than generalized. Okay, so purple's kind of like go to your dentist, ask them what they think is going on with the purple. Now, if you have red gums, specifically red, that usually means you have gingivitis. Red, swollen, bleeding, all of these words describe unhealthy gums. Not to say they can't get healthy again, right? Gingivitis is the first sign of gum disease, right? Periodontal disease, there's different stages. With gingivitis, there's a good chance we could turn it all around and we could reverse it, right? But once you get to periodontitis, the farthest, the end stage of gum disease, periodontitis, periodontal disease, then oftentimes it can't be reversed. So long story short, if you're having signs of red, swollen, bleeding gums, visit your dental office, get a professional cleaning. Maybe you just need a regular cleaning and then you could get back into your routine, brushing, flossing at home, doing all the things. But maybe you need a deeper cleaning, some kind of scaling and root cleaning underneath the gums. Maybe you have tartar below the gum line that's irritating and aggravating your gum tissue, making them red, swollen, all that stuff. So hopefully that kind of answers your question. Someone's from India. What's up? This is amazing. I would love to go to India. Oh, and then someone said I'm in Indy, Indiana. Did I read that wrong? Was someone from India? And then someone was from Indiana, right? Both? Yeah, both different. Okay. Making sure I didn't read that wrong. So amazing. Okay. Someone asked a question about dental hygiene school. What did I see about dental hygiene? I'm so excited. I love seeing where everyone's from. Hello, I'm in hygiene school right now. Okay, I'm so excited for you. Can you give tips on opening and closing motion using curettes? Opening and closing motion. Curettes, like scalers, like a way to scale the teeth, curettes, opening and closing. I'm not sure what you're asking exactly. So I think that's Jacob. Just ask me again in a different way because I don't know. Did you mean cassettes or am I not understanding right? Just let me know. I'd love to answer that question. What else we got here? How do you manage individuals with disabilities during pro-fees? Any tips? Yeah. So, it depends. There's so many different disabilities. There's physical, there's mental. I would say even like the elderly, the community population of anyone with arthritis, can cause you manual dexterity issues that make cleaning your teeth at home difficult, right? So I would just say my best answer to that is dentistry is based on the individual, right? It's individualized. So it's not a one size fits all. Someone who might need more help physically, I would usually talk to them and or their caretaker and or parent, depending on their age, about ways to supplement and things to add to their routine at home, right? Maybe I'll have a patient who really can't use their hands properly. And so we talk about additional home care tools to use, right? Because there's only so much I can do every 6 months or every 3 months, however frequent you're seeing your dental hygienist for your cleanings. Of course, I could get in there and clean and get rid of the stuff you can't at home, but what you do every day at home matters the most. So I focus a lot to answer the question on disabilities. I focus a lot on what we can do and change and make better at home because that's going to make all the difference versus what I do in the office. But yeah, having said that, also sometimes we just need to schedule more frequent cleanings, right? When someone can't help themselves at home that much. But yeah, there's a lot of different tools and techniques we can talk about depending on what the disability is. Okay. Someone said, I have some spacing in my teeth and an overbite. Will I need braces? Okay. Generally when I read something like that, we can't give medical or dental advice individualized online, especially without seeing your teeth or seeing your x-rays. But oftentimes, if there's bite issues where your teeth bite together improperly, not correctly. I was trying to be all fancy and I was like, I'm saying that word wrong. So if your teeth don't bite together right, that could indicate could be a sign that you might need braces, especially some spacing, but not always, right? So, but oftentimes your dentist will even say to visit an orthodontist to get an evaluation assessment on whether or not you would benefit from braces. More likely than not, yes, but in some cases, maybe there's something else that they can do for you. But I'm excited to hear what your consultation evaluation ends up being. They'll take some x-rays, they'll take pictures, see how your bite looks, all this good stuff. Okay. Someone asked, I got a cleaning about a week ago and I was sore for a few days after. Is that normal? So it's not normal and it's not unnormal. I guess my point is it could go either way. If you're sore after your cleaning, it's fine. But if you're not sore after you're cleaning, that's also fine. I know that's like not a good answer, right? Meaning it depends. So sometimes you might have just had a little more buildup than usual. If you're not usually sore, maybe that time you just had a little extra buildup, right? Other things like hormones can really change how your teeth feel, right? Different times of life and different, there's so many different, like if you have a headache or if you have jaw pain, if you were clenching and grinding your teeth the night before, there's so many things that can contribute to having a little more pain when someone cleans your teeth. Or the clinician was just a little more rough. So there's just so many things. So I wouldn't worry about it. A few days, pretty normal. If it's really bugging you, warm saltwater rinse can help so much. If it's more than a week, I would definitely call your dental office and see what's going on. Okay, I'm just scrolling through. This is so fun. Okay, someone just said, do teeth grow old? Hey, yes. I will say my boss, whenever an older person says like they're having pain and he can't find anything wrong with their teeth, and oftentimes it's like wear and tear, like our backs, our necks, our feet, our legs, our hips, right? As we get older, our body kind of gets older and our teeth are included, right? Someone asked, are you a DDS? No, I am not. I'm a registered dental hygienist. I'm not a dentist. So I'm an RDH. Are traditional or removable braces better? I don't believe I would have an issue remembering to wear them. Thanks. Oh, very good that you said that. Thank you. Nice guy, E. So yeah, I was going to say, it depends again. Sorry, everything is based on the individual. So I'm just giving generalized information here. But traditional and removable braces, meaning like Invisalign or some kind of clear aligners versus the brackets, the metal that you see, they are both good for different reasons, right? I love how this person, Nick, thank you, said I don't believe I would have an issue to remembering to wear them, right? So that's good because compliance is a huge thing. Sometimes if you're someone who could benefit from either braces or Invisalign, we use, the dentist or the orthodontist might give you the option. Do you think you'll wear the Invisalign, the clear aligners? Because you have to take them in and out. If you don't think so, then maybe consider braces, right? So that's if you have the option. Whereas some patients, if your teeth and jaw, if there's a lot going on and it's a more involved case, you oftentimes will benefit more from the brackets because just depends. So sorry, that didn't really answer your question. Let me put this here. I don't see them. Sometimes I'm using something different here where usually, wait, hold on, start. Oh no, I see it. Okay, good. Never mind, I see it. Okay, I was like, sometimes, thank you so much. You can do these, let's see here. I'm like, you're like, what is she looking at? So I have two different screens here. Did that make sense? Okay, so there's the super chat. I see it. There it is to the screen. Okay, perfect. Thank you. Oh my goodness. So KI Millions said, thank you for all that you do. This is a super chat. Thank you so much. I really, really appreciate your support. Thank you for this kindness and for being here. I couldn't find where those were, and now I see where they are. So that's so nice. What's this? Oh, there's so much going on in here. Okay. Okay, so someone asked, what do hygienists do? I love this question. Very good question, because a lot of people don't know there's a difference between a dentist, a hygienist, and a dental assistant. So a dentist is a doctor, right? They went to school to become a doctor of dentistry. So it's usually around 8 years of school, more or less, depending on where they go. It's usually going to be 7 years minimum usually, but it's usually 8-ish years, maybe more if they specialize. They could be orthodontists, periodontists, all the different types of dentists. Take a sip. So that's going to be like 8 years. You're the doctor. You're diagnosing and treating cavities, tooth decay, tooth infections, right? You are restoring broken teeth. You are removing You are removing my roof. It's fine. You're removing teeth that are unhealthy. Okay. So when a tooth is broken or unhealthy, it needs to be fixed. That's what a dentist does, fixes the teeth. Of course, they also do checkups and make sure everything is status quo as well. They check to see if any teeth need to be fixed. Now, a dental hygienist. This is the second one. We're going to go through all three. Dental hygienist. This is a person who is the prevention specialist, right? I'm a hygienist. We're making sure your teeth and gums stay healthy. We want to prevent your teeth and gums from ever needing to be filled or drilled and filled or removed or infected, right? We're trying to get these problems taken care of before these problems even exist. Okay. So that's what a dental hygienist does. The schooling is you can get it done in 3 years, maybe, but it's usually between 4 and 6 years. So there's an associate degree option, but it's a 2-year program, but you need at least 1 to 2 years of prerequisites. So altogether, you need 4 years usually for your associate. There's also a bachelor's degree, which is, of course, 4 years. And then there's like other ways to do your bachelor's. Some people do a bachelor's in something else and then 2 years of dental hygiene school after. So it's 6 years. That's what I did. Some people get their master's after. You could get your master's in dental hygiene. I'm actually working on my doctorate right now, not in dental hygiene, but in health science. So you could keep expanding and increasing your education with dental hygiene, but you do not have to be a doctor. And then the third option is dental assisting. So I was a dental assistant before being a dental hygienist. Now, every state differs a lot with dental assisting. Shout out if you're a dental assistant in here. Let me know what your state does. But I don't know. It's hard to say. A lot of states do not require any formal schooling, and a lot of states do. So it just depends what state you're in. If you're in the US, of course, Canada is a little different, the different provinces, and then worldwide, sometimes they're called dental nurses. I know in Europe, a lot of maybe some European countries or in the UK, they'll say dental nurse for dental hygienist. Some have dental therapist for a hygienist, or dental therapist is an expanded functions dental hygienist. So there's all these different, but I'm just trying to make it simple. The three: dentist, dental hygienist, dental assistant. Back to dental assistant. Oftentimes there is no formal training. However, you can do a certificate program. It's usually less than a year. And the dental assistant is the person who assists the dentist, right? Or sometimes assists the hygienist, depending on what kind of office they're at. So dental assistants, of course, honestly, they run the whole office. Like, they are the heartbeat of the office. They are making sure that the dentist needs everything or has everything that they need. Not only are they passing the next instrument to make patient flow quickly and make these appointments go quicker for you, so the dentist, can boom, 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 do everything they need. They're also cleaning the room, sterilization, sending things out to labs. They're just doing everything. So those are basically the three different. I know, because I was a dental assistant. I know whenever I talk about dental assistants, before I say I'm a dental assistant, of course I revealed that, but people will be like, "Oh, I can tell she's a dental assistant because she's been there." I've been there. It's a hard job, but it's a very rewarding job. You really are like the life of the office. Okay. So someone said, I've never seen your uvula. I have a uvula video, and at the end, I do show my uvula. It exists. I promise. Just type in uvula teeth talk girl, and that video will pop up. And at the end, I did like but having said that, speaking of that, anyone who has any specific dental questions, dental hygiene questions, dental toothy topics that I'm not covering here, be sure to always, oh my goodness, I have a video for almost every topic there is in dentistry. I have a whole catalog. So if you on YouTube here, they have a really nice, easy search on YouTube. You just type the topic and then Teeth Talk Girl after it, and my video will pop up. You know what I'm saying? So if you're looking for a uvula video, just type uvula Teeth Talk Girl. My video will pop up. All right. I have time for a few more questions. Okay. Someone asked, thank you for your reward. Oh, thank you so much for your support. I really appreciate that. You have tips for going to the dentist with autism. Yes. So if you're the patient, someone asked earlier as the clinician, but if you're the patient and you have autism, right, it's a spectrum, of course. So what works best for you, right? So my best advice is with any patient of mine that has autism or any type of anything that makes going to the dentist a little more difficult, I just always say, just like, let me know what will help you. We are here to accommodate your needs. You know what I'm saying? Like, it's not a one size fits all. I have some patients that want to wear headphones. That's totally fine. Just let me know. Like, hey, I'm going to be more comfortable if I wear my headphones. I have some patients that want a stress ball, or like if they forgot their stress ball, we've got stress balls on hand for them just in case. You know what I mean? So sometimes just having something to do with your hands can help so much. I'm trying to think of like other little random tips, but communication is key. Communication is everything. Whether or not, depending on your age, whether or not you want someone in the room with you. Some people do better with a parent in the room. Some people do better by themselves. They don't want a parent in the room. The less distractions, the better. So, or a friend or a family member, whoever you want in the room with you, that's fine. Just let us know. Or if you're like, hey, I really just want it to be you and me, I work better with less distractions, that's fine too. We are here to accommodate your needs. We could get you a weighted blanket. We could put the x-ray, the lead apron on you if you want. Sometimes that heavy lead apron feels really good. So those are just some ideas of things you could maybe ask for, because it's true. Sometimes you don't know what's going to make you comfortable and calm yet, but just trial and error. And once you find what works for you, we're happy to accommodate you. So I really hope that kind of helps. Oh my goodness. Okay. Kobe, thank you so much for your support. How much is okay for a well done single tooth implant? How much is okay? Wait, what's the question? Okay. So a New York professor. Oh, you're asking for the price. Okay. Asked you for $6,000 to $9,000 for a single implant. Better I go to Turkey for $4,000 with flight. Okay. I'm making a video on turkey teeth right now. Okay. So New York. Okay. So cost of living in the area is going to make all the difference, right? Someone said they're from Indy earlier, like Indiana. So like a rural area of Indiana versus New York City, Manhattan, the cost of an implant is going to be so different, right? So I hope that makes sense, right? $6,000 does sound fair for like Chicagoland, where I'm from. It's usually between like 4,000 to 6,000 for an implant, including the crown and the implant itself and all that. So 6 to 9 isn't crazy for Manhattan. You know what I mean? Cost of living is everything. Again, San Francisco is going to be a lot more expensive than a rural area of Kentucky, So I hope that makes sense. But yeah, I never think it's a good idea to just find the cheapest route. Like a lot of people are doing go somewhere else for a cheap dental work, whether it's the turkey veneers or implants. Just know that sometimes you do get what you pay for. Sometimes you do get what you pay for. Not always though, right? Do I know a lot of people who went to Turkey and they're very happy with the results? Yes. But do I know a lot of people that write into me and they're like, I have to fix every single tooth and now I'm going to spend more money than if I would have just done it where I live in the first place? You know what I'm saying? So be careful with these marketing. I'm not saying Turkey does bad teeth. I'm saying some of these marketing agencies you got to be careful with. If they're advertising you to get implants or veneers and you didn't even think you needed implants or veneers, you know what I'm saying? Just be careful with the app. Sorry, I have a lot going on in here. Speaking of distractions, anyway, I hope that answers your question. What I would do is I would stay near where I live, find a dentist that I trust, and not go over too far somewhere that you might need to go again, because now it's going to be double if you have to go there and something goes wrong. But that's just my 2 cents. Talk with your individual dentist to see what they think is best for your mouth, but hopefully that kind of answered your question. And then I have a couple more. Oh, thank you, Noah, for your support. I truly appreciate it. Shout out Noah Martin. And then JSCH5. Thank you so much for your support. And you have a question. Can Dr. Bronner's soap be used as an alternative to toothpaste? The owner of the company says that it is fine to do thoughts. Okay, so I'm not familiar with this soap. Hard for me to say when I don't know the ingredients. I could Google it really quick. So I guess my answer is alternative to toothpaste. My initial gut, I'm like immediately like, ask your individual dentist, dental hygienist, bring in the tube of this soap and ask them. My initial thought is that I would just assume because it's called soap that it doesn't have any anti-cavity ingredients in it. So I would think, it's probably not going to protect against cavities. That's just an assumption. Maybe I'm wrong. I hope I'm wrong. So be careful. Make sure it has anti-cavity ingredients. The whole reason we brush with toothpaste is to help remineralize and strengthen teeth. We can brush with just water and we can help prevent gingivitis, all that stuff, cavities. But the only thing that's going to strengthen your teeth and your enamel is an anti-cavity ingredient, such as fluoride, such as nanohydroxyapatite, such as something like that. So if it's the correct form of nanohydroxyapatite, I could talk for 2 more hours and all that. But if you want to learn more, you can go ahead and search nano toothpaste Teeth Talk Girl or fluoride toothpaste Teeth Talk Girl, and it will give you all the information. And then, okay, so here's the thing. I love this so much. This is so fun. I love doing these YouTube lives. And guess what? Although this live is about to be over here on YouTube, my live isn't over tonight because I'm actually going to head over to Instagram right now because I have 3 packs of whitening strips to give away. Okay, so I'm going to go play trivia on my YouTube account. Excuse me, I'm on YouTube. I don't want to leave YouTube. I love it here. I'm going to go play trivia on my Instagram account to give away whitening. So you could win this. It's, got a bunch of whitening strips here. So follow me over on Instagram. My handle is @Teeth Talk Girl. Let me see if I can write it in the comments section. Where are my comments at? They went away. Oh, they're back. @Teeth Talk Girl. Did I spell it right? Can you imagine I spell it wrong? Oh my gosh. And if you don't have Instagram, no worries at all. Okay. Because I'll be here again and you can always write into my posts. I have the post section on YouTube. I'm happy to answer more questions there. Just below this live, if you saw, my community post section, write any that I didn't get to. And then of course, don't forget to put say you're looking up cold sores or canker sores, right? Cold sores, canker sores @Teeth Talk Girl in the search bar, and you might find me answering those questions. But until then, I'll see you on Instagram @Teeth Talk Girl. Right now, I'm going to go over there in 1 minute. I said I would start at 8 p.m. Central Time. Right now, it's 7:58 here, so I still have 2 more minutes with you all. But if you don't have Instagram, no worries, right? Okay. I hope you enjoy Valentine's Day. Happy early Valentine's Day. I'm sending all the toothy vibes and love and the vibes and more vibes your way. Thank you for joining this toothy Q&A here. And let's go to trivia. Let's go to do trivia on Instagram. And don't be sad if you don't have it because I'll be back here soon, sometime in March, right? Okay. Did these Mondays work good for you all? Do you prefer Tuesdays, Wednesdays, Thursdays, Fridays? Let me know what day works for you best on that community post. I would love to know what day works best so I can start doing more of these. I love doing these. I love talking with you. And I want to answer so many more questions. And I will do a full hour next time. I know today was just a half hour, but until then, I'll see you on Instagram. Let's go win some whitening strips. I'll see you there @Teeth Talk Girl. Peace, love, and teeth.